My project involved my past 24-year history of using the same type of pager system in every healthcare organization I have worked for. Those pagers are pictured on the screen. I have had many struggles with the current pagers used. I have also heard numerous physicians and other healthcare workers complaining about the current archaic system and its limitations. One would have thought with all the advanced technology we would have a new, much more robust system. So I took my idea to the next step and started doing research. I did a Google search for healthcare pagers, and I found no new paging systems, but rather thousands of new applications to use smartphones. I did a Google patent search, and while I found older paging systems, but no new ones seeking patents. I performed a search on why doctors still use pagers, and found many reasons why they are so relevant, and what I found follows. There are technical challenges to cell phone technology, as they are tied to cell signal and wireless signal, both prone to go down during natural disasters and technical issues. Pagers use radio frequency signals, which do not go down during times of natural disasters. Phone recharging takes time, and as you know, cell phones are always low on charge. And cost to roll out new cell phones with paging capabilities is 20 times as expensive as pagers. There is also the issue of HIPAA compliancy, as pagers remember no patient data, while cell phones do. Next, I searched for new physician paging systems and found many more sites offering cell phone-based HIPAA-compliant applications that can turn your cell phone into a paging system. I still could only find the old-style typical pagers one see on a doctor's side today. As seen on the screen, this is what most healthcare workers and physicians use today. A quick article search from June 2015 caught my eye that asked the question, why pagers are still a thing. The summary is this: pagers are inexpensive, HIPAA compliant, very reliable, and fulfill a need, and they are not as distracting as cell phones. In the article, Why Doctors Pagers Still Trump Smartphones, paging systems also outperform cellular networks when it comes to broadcast power. Paging systems have up to 7 times the power of cell systems, translating into better signal penetration in buildings. A single paging transmitter site typically covers 176 square miles, while a typical cell site covers only 10 miles. Smartphones are also perceived as negative by patients. Smartphones can act as pagers, however, patients view smartphones with a dissatisfaction and the impression that the physician is not being in the moment with them. As cited by Blocker, Hayden, and Bullock, patients are likely to have a negative opinion of doctors using mobile devices in the workplace. Patient satisfaction is a huge driver in healthcare, and medical and Medicare insurance reimbursements are driven by more and more patient satisfaction scores. Next, I did some brainstorming. I used numerous methods to generate ideas about my new next generation pagers. I sat in a quiet room and wrote down my thoughts. I drew pictures. I asked my staff to think of ideas. I even changed my perspective and walked through the halls of the hospital to help generate different creative juices. I also took my current pager, and took it apart and tried to think how I could replace the pieces to make what I felt was the perfect paging system. I asked numerous physicians and staff that use pagers how would they make their pagers better. If they could create a better paging system, what would this look like? And this was the great feedback as we kicked back and forth ideas on what would make a better paging system. As we proceed to the framework for innovation, quality, cost efficiency, and how the patient's needs are met are directly applied to a framework for innovation. Quality of care is impacted by the ability for a physician to respond to patients in a timely manner. Patient quality and a lack of effective communication can impact the patient's care continuum and reduce the quality and safety of care given. Physicians and nurses working in hospitals waste an average of 46 minutes a day when they use beepers to exchange information about patients. For hospitals, the cost of lost productivity due to outdated technology can equal $8 billion. Elevator pitch. A patient's health suddenly begins to deteriorate. A physician is paged to the bedside due to an emergency. The nurse calls, pages, and still no answer. Precious seconds pass by. Should the nurse call a rapid response to get all the available people to the bedside, or wait for the patient's physician to call back? These types of critical medical situations occur every day in hospitals across our country. Current physician paging systems are archaic and do not accurately fulfill the communication need for the persons involved. Quality of care is impacted by the ability for physicians to respond in a timely manner and prioritize their pages. CNN Money states for hospitals, the cost of lost productivity due to outdated technology translates to more than $8 billion annually. The solution is a smart screen dual paging system that has both radio frequency pager and wireless cell capabilities for the smart screen functionality. No other paging system does what this new smart screen paging system can accomplish. The capabilities to have all messages at your fingertips with the added ability to save, park, prioritize, and answer messages while encrypted the data to be HIPAA compliant is what separates this from other pagers. Every healthcare worker and physician who uses pagers can benefit from this new innovative pager system. And the resource to make this idea a reality. The technology already exists for this innovative device to be created. All that is needed is a cell phone-like smart screen for the face of the pager, like the one on the screen. This technology exists today, and the cost is low. This will take software designers and engineers from both pager and cell phone companies. An encrypted program to keep patient information HIPAA compliant, which would entail more software engineering. And then, of course, the extended battery technology, which currently exists today, that keeps the device running for over 10 days without a charge. We have the current affordable technology, and all we need is an innovative mind and a forward-thinking company to create a new multifunctional pager system. Thank you.